So we're quickly trying to talk about another characteristics of the spinal cord in degenerative diseases. So this is what they call the spinal fusion or bamboo spine. You know that in a normal spinal cord, you should have these vertebral discs separating it. Do you understand? But if the vertebral disc is kind of like eating up, okay, spinal cord is compressing, it's now looking like a bamboo stick. Hence, they call it the bamboo spine. Alright, so that's just it. Of course, you see this in what? Inflammatory conditions, degenerative conditions of the spinal cord. So, they said that is a striking radiographic feature. Yeah, you actually pick it up on imaging, right? Because for a human being that has this issue, you don't have to like be opening their spinal cord to see it. Alright, except maybe they are dead, okay, and you are doing autopsy. So you mostly pick it up on imaging. Alright, so it's seen in what? Advanced ankylosing spondylitis. That's a chronic inflammatory arthritis that primarily affects the spine, the sacroiliac joint. So it's not a surgical spine fusion, but rather it's a pathological fusion. Alright, so once you see this, know that this person was affected by inflammation. Do you understand? So why bamboo? The spine takes a rigid grooves appearance on X-ray, resemble the bamboo stick, just like I explained. Right, so hence the name. So this happens when what? Syndesmophytes bridge adjacent vertebrae. So the intervertebral discs ossify, the vertebral bodies become squared and sclerotic, creating a continuous column of bone. So instead of the bone to have clear demarcations, it's kind of like looking like continuous. Alright, with just a little demarcation looking like a bamboo stick. So how it develops, chronic inflammation is there. So over time, it results in fusion of the vertebrae, especially in the thoracolumbar spine. The process is irreversible and flexibility is greatly lost. Okay, so clinical implications: there's reduced movement there, and the person is kind of like bending. The posture is different now; it's bent. All right. There's increased risk of spinal fractures. May cause neurological complication if it compresses any nerve around that place. So for you to view this, you use X-rays, MRIs. Okay. So management: you are using drugs that will stop inflammation. That's NSAIDs. Drugs that will stop your immune system from attacking the body cells. That's biologics. All right. Physical therapy to maintain mobility. Then surgical options in severe cases. All right. So that's it for a bamboo spine.